Let's also talk about the situation in Texas. In Houston, for example, intensive care units in the Houston area, are at 97% of capacity, according to the city. Let's bring in someone from Houston. That's Dr. Hilary Fairbrother. She's with the McGovern Medical School, which is the sixth largest medical school in the country. She's an emergency medicine physician, but also an expert on public health. Dr. Fairbrother, thank you for being here. That's an alarming figure that we just got from Houston, that beds are at 97% of capacity, ICU beds. What's interesting is we've been hearing that much of the latest spread is among younger people who are perhaps less likely to show symptoms of coronavirus, to become acutely ill. Is what's happening in Houston and in Texas that they're spreading it to folks who are more vulnerable and they end up in the ICU?
It's honestly, Julie, it's hard to tell. We are seeing increasing rates of illness diagnosed in young people. They are therefore statistically less likely to be seriously ill. They are therefore statistically less likely to land in the ICU or to need a ventilator, thankfully. I also think that there have been people in our population through illness or age who are very vulnerable, who really taken a lot of the social distancing and the masking very seriously. And hopefully we're seeing some efficacy of those recommendations and a decrease in illness in our vulnerable and our very old. So I think there's probably a lot of different factors that are in play as to why we're seeing more illness in younger people. It's a commonly known statistic that younger people are more likely to be some of your essential workers, some of the people that really have not been able to stay at home because their job mandated them to go to work.
I am curious, though, for instance, in the New York area, we've not seen a spike related to the massive protests, and there were a lot of young people in the streets here. And yet we see a great deal of criticism for the gathering the president had in Arizona yesterday with a lot of young people. What's the difference between indoor, outdoor, and how does that really play? What do we know?
Well, so I think it is just easier, just common sense. It's easier to be farther apart from each other if you're outside. There is less of a concern about recycled air or ventilation or air conditioners or all of the different things that I have heard about when it comes to holding an event inside. I think that, if somebody is outside, they see somebody walking towards them, they want to maintain their 6 feet distance, they can typically move away a lot easier than if you're sitting in a chair in an auditorium next to another person with the people on either side in front of you and behind you. So I think there are differences to holding outdoor events versus indoor events. And I know that a lot of businesses, I saw a local theater building an outdoor stage so they could have their performances, but actually keep people separate while they watch the show. That would never be able to be an option for an indoor theater. So I think there are just differences about being inside and outside. And I watched a lot of these protests. A lot of the people did seem to be walking not like right next to each other. And I did see a decent amount of mask wearing, at least in the protest here in Houston, that I watched the most closely. So I also wonder, I think it was reported that at some of these indoor events that have been recent, that the amount of mask wearing was very low. And I do worry about any kind of large gathering period, but any large gathering where there is really low amount of mask wearing, I think is a high risk event, period.
Hi, Dr. Fairbrother, Rick Newman here. So many of us here in New York have been through this. I mean, it sucked. You had to get used to wearing a mask and staying away from people. Why did places like Texas not learn the lesson that we seem to have learned in New York? Is this one of those things where maybe a lot of people just have to learn this lesson for themselves in their own communities?
Well, it's funny that you asked that, Rick, because I moved from New York City just 3 years ago, and I had lived there for 12 years. I have a deep love for New York City, and I practiced emergency medicine there for 12 years in multiple different hospitals in the region. So it was awful to watch this happen to New York City. And because of that, I had a very personal experience with COVID in New York City. I had friends who got ill. I had colleagues who got ill. I had hospitals I worked at telling me stories. I honestly, I couldn't even imagine. They were so surreal and so terrifying. Most people in Texas, in Texas, we never got the spike of cases. We never saw the number of people that we were supposed to have. We saw
Well, you're getting it now. I mean, that's what's happening now, right?
Well, and so, but it's not hard to see why behaviors didn't change and why behaviors didn't stick if we never had the cases to back it up. There are very few people who know someone who's been seriously ill with coronavirus. In New York, I find it hard to find someone who doesn't know someone who died of coronavirus. And death is personal. We do not react well as humans to this threat of this unknown thing we can't see a lot of times until it becomes intensely personal. So I wasn't surprised when our economy opened back up. We never had the cases really to justify keeping it closed. And then we opened, and a month later, we were still at the same base level of cases. I think when we started really seeing fatigue in personal behaviors, people started gathering, people weren't wearing masks anymore, people were starting to just go see family and to at least do like local vehicular travel. That's what sets you up. When you've got this baseline of COVID never left our community. When you've got a baseline of COVID in the community, and now you have people getting together, now your rate of transmission increases, your number of cases increase, your number of hospitalized, your number of ICU borders, they all increase.
Dr. Fairbrother, I have to push back a little bit because originally that was my thought process too. If folks knew someone, or at least tangentially someone who knew someone who had passed away or was severely ill from the virus, perhaps they would take it more seriously. But we did see a lot of commentary from the Tulsa rally with so many interviews with folks who did say that they had a family member or loved one pass away. But one of the notable quotes out of those interviews was, but we don't know who to believe. There's so many different sources of information right now that I don't know what is a credible source, even though there is a life that has been lost. When you think about the politics of this virus, how has that affected your job? I'm sure it's an added stressor during this time where it is a global health crisis and suddenly it's become politicized.
Thank you, Melody. Honestly, I think that the politicization of science is in one of our incredible societal downfalls. Science should not be politics. We should not be having arguments about science as if one person is right and one person is wrong. We should be having educated discussions, and we should have people that are telling the truth to the public. And I think that this has become such a conversation that is incredibly influenced by someone's political agenda. And the way that I was speaking to my husband, and I said, either I talk to people and they want to close down the entire world for at least 3 years until there's no coronavirus left anywhere in any corner of the planet, or they never wanted to close anything. They don't care how many people die. As long as it's not them and their loved ones, there's no middle ground, and there's no common sense, and there's no application of just good science. And it is hard. I see really great people throughout our governments, our states, our cities, really trying to push hard for us to stick with science. And I do appreciate all of you having me on to ask questions, because I have a master's in public health. I am a practicing emergency physician. I am a scientist. I am an expert in this. And people like me, we don't usually get a voice on these kinds of matters. So I appreciate what you guys are doing. And I also, I beg people to actually listen to scientists and maybe stop listening to politicians on all things coronavirus.
Dr. Fairbrother, thank you so much. We appreciate your input on all of this and your expertise. Dr. Hilary Fairbrother, an emergency medicine physician in Houston, Texas. Thank you again.
Thank you.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.